This video is about polycythemia. One of you asked me to do a small video about polycythemia. So here is the video for polycythemia. TGIF, today is October 31st. Happy Halloween. What is polycythemia? Polycythemia means abnormally high number of red blood cells in your bloodstream. When RBCs increase, the blood becomes thicker, more viscous like a syrup. It slows down circulation and increasing the risk of clots, stroke, and heart attack. So, what are the types of polycythemia? There are two types, primary types and secondary types. Primary polycythemia, other name is polycythemia vera, where the problem is in bone marrow. It's a bone marrow disorder caused by genetic mutation, usually JAK2 mutation, JAK2, JAK2 mutation. Marrow makes too many red blood cells, sometimes too many white cells and platelets as well. It's a chronic blood cancer, but progresses very slowly. Secondary polycythemia, where the bone marrow reacts normally to something that is increasing erythropoietin, which is a hormone that triggers RBC production. Common triggers include chronic low oxygen, like a patient with COPD, chronic lung disease from other issues, sleep apnea, high altitude, smoking, carbon monoxide exposure, tumors that secrete epogen, like kidney or liver tumors, use of anabolic steroid or testosterone, people with a bodybuilder people, WWF, the lots of muscly people, they use testosterone. And I'm sure you have heard that a lot of them, they die early. And that's one of the reasons. Symptoms, headache, dizziness, ruddy or flushed face, blurred vision, fatigue, itching after hot showers, because that releases histamines, tingling or burning in hands and feet, high blood pressure, enlarged spleen, because the spleen is busy eating lots of deformed red blood cells and they can't keep up. Some people may not have any symptoms and diagnosed only after routine blood test shows high hemoglobin or hematocrit. Diagnosis, we do complete blood count. CBC shows elevated hemoglobin and hematocrit. Erythropoietin level is low in primary polycythemia vera, and high in secondary type. JAK2 mutation test is done as well, which confirms primary type, which is polycythemia vera. Oxygen saturation and sleep studies, where you suspect low oxygen, hypoxia related causes, which is increasing epogen production, leading to polycythemia of secondary type. Abdominal ultrasound is to check for spleen and kidney tumors. Treatment for polycythemia vera, primary, phlebotomy, regular blood removal, like donating blood to reduce RBC's count and thickness. Low dose aspirin, baby aspirin, prevents clot formation. Medication commonly used is hydroxyurea, which basically is to kill some of the cells, red blood cells. Cytoreductive therapy to suppress bone marrow overproduction. There's other medication, ruxolitinib, JAK2 inhibitor for resistant cases. Lifestyle, stay hydrated, avoid any iron supplements that stimulate RBC. Actually, I had a patient about a few years back, and he had this problem, and we really couldn't figure it out. And we're all like, what's going on with this guy? So one day I sat down with him and I asked him, how does he do his cooking? And found out that he uses iron skillet for all of his cooking, because that's how he was told that's great for your health. But in this process, he was eating some elemental iron every day with his food, and which was leading to high level of iron in his body and polycythemia vera of secondary nature. So that took care of it. I told him to stop using iron skillet. So if you're using iron skillet for cooking, be careful. Secondary polycythemia vera is, treat the cause. So you got to manage COPD, stop smoking, use CPAP if you have sleep apnea, and remove EPO producing tumor from kidney. And also phlebotomy only if symptoms of high viscosity persist. Avoid smoking, exposure to carbon monoxide, stay well hydrated, reduce blood viscosity, keep blood pressure and cholesterol under control, regular exercise, sleep well, sleep well, sleep well. Get periodic blood tests if you live at high altitudes like Aspen in Colorado up there. Get periodic blood test. Complications if untreated, it can cause stroke, heart attack, deep vein thrombosis, pulmonary embolism, gout from uric acid buildup, myelofibrosis, which is bone marrow scarring, leukemia, rare cases. So here it is for you, polycythemia. And next video is going to be about placebo and nocebo effect as a follow-up from yesterday's video about your belief system. So wait for that. Have a great weekend.